Breast pain, Mastalgia, is a common symptom among women and it is not specific for any disease. That's why it is important to differentiate the origin of breast pain. Some degree of cyclical breast tenderness is normal in the menstrual cycle and is usually associated with menstruation and/or premenstrual syndrome. Most commonly, painful breast mass in women younger than 50 years old is caused by fibrocystic changes. In young women, pain that involves both breasts and which occurs repeatedly before the menstrual period is generally not serious. In 2/3 of menstruating women, cyclic pain is usually diffuse, bilateral, and most often associated with fibrocystic change. It is not disease and it is not serious condition. Pain that involves only one part of a breast is more concerning. It is particularly concerning if a hard mass or nipple discharge and not associated with breastfeeding or pregnancy. If skin deformation on the breast is presented, it needs medical attention. In about 2% of cases, breast pain is related to breast cancer. Pain alone is rarely a presenting symptom of a malignancy. Breast cancer usually characterized additional symptoms and risk factors besides pain. Sometimes breast cancer is not associated with breast pain and it is painless at first stages. Mean age for breast cancer is 64 years old. It may develop at any age. Risk increases with age. If breast mass develop after 50 years, cancer is highly susceptible. Risk factors for cancer also represents genetic code. If breast cancer involves first-generation relatives, mother, sister, genetic basis is involved in less than 10% of cases. Autosomal dominant BRCA1 and BRCA2 mutation association, the breasts or ovaries are frequently prophylactically removed. Lifetime risk is breast cancer risk in women is 40% to 85%. But breast cancer is not most common cause of non-cyclic pain of breast. Non-cyclic breast pain is localized and is most often caused by a cyst or mass. Mastitis, inflammation of breast tissue associated with pregnancy and breastfeeding. It is may presented as bacterial infection in 15%. If breast pain occurs during pregnancy or soon after delivery, it is mastitis with high probability. Sclerosing adenosis, a proliferation of small ductules or acini in the lobule. Pattern is often confused with infiltrating ductal cancer, often contains microcalcifications. Mondor disease, superficial thrombophlebitis of veins overlying the breast. Presence as a palpable, painful cord. Over time it may become painless. Traumatic fat necrosis, necrosis that occurs in fatty tissue as a result of blunt trauma or surgery. Clinical findings, initial painful mass in the acute stage after trauma followed by the presence of a painless, indurated mass that may produce skin retraction simulating breast cancer. Silicone breast implant also can cause breast pain and inflammation. Fibroadenoma, benign tumor derived from the stroma of the breast. Most common breast tumor in women less than 35 years old. Fibroadenomas develop in 50% of women who receive cyclosporin after renal transplantation, present as a discrete movable, painless or painful mass. Multiple fibroadenomas may be present in 10% to 15% of cases. Factors that decrease the risk for breast cancer include breastfeeding, moderate or vigorous, physical activity, and healthy body weight. Prophylactic oophorectomy decreases breast cancer risk by 50%, and prophylactic mastectomy decreases breast cancer risk by 90%. Breast cancer characteristics. Painless breast mass, usually, not always, in the upper outer quadrant. Other potential findings include skin or nipple retraction, painless axillary adenopathy, hepatomegaly, bone pain if metastasis has occurred. Diagnostic mammography is the first imaging study performed in a newly discovered breast mass. Mammography screening has a sensitivity of 67.8% and a specificity of 75%. Mammography does not distinguish benign from malignant, although some findings are highly suggestive of malignancy. Screening usually starts annually at age 40 years, Recommendations vary, but earlier if the patient is high risk. MRI screening is reserved for high risk, greater than 20% women such as BRCA carriers.